Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, and welcome to the latest edition of the Health and Fitness Show. I am your host, Suliman Rafiq, and I'm delighted that you're joining us to talk about another important health-related topic here in Luton. I am also joined by two guests today who will be discussing a really important topic in regards to vaccinations. So without further ado, if I could ask my guests to please introduce themselves and explain why are you here today. Nancy?
Hi, my name is Nancy. I'm a medical doctor specializing in public health. Myself and my colleague Hannah here are both new mothers, and we really want to talk to everyone about vaccines in pregnancy. There are two reasons for this. I worked in the intensive care unit in hospitals before, and I really saw how vaccines massively lowered the unwell patients we see in hospital, and really want to put that message across. And second of all, because we're both new mothers, we know how important this is for mothers and babies. So we really want to talk to everyone today and pass on to my colleague Hannah.
Yeah, hi, so I'm Hannah. I'm a specialty registrar in public health, and I work in NHS England, East of England team, in the screening and immunisations team. And yeah, as Nancy said, I'm also a mum, so I've got two girls who are 4 and 1. And part of the reason that we're here today is that there's actually a new vaccine that's going to be available this winter against something called RSV, which is respiratory syncytial virus, which is a virus that affects breathing. And my older daughter, when she was just a month old, actually we had to go to hospital with RSV. So like Nancy said, this is a topic that's really close to my heart. The vaccine wasn't available then. But yeah, we just really wanted to come today to talk about vaccination in pregnancy and just encourage anyone who's pregnant who's listening to get their vaccinations.
Absolutely. No, we're really grateful for you giving up your time and coming over to Luton to talk to us about this. And I've seen, I think it was on the BBC yesterday, like you say, it's really exciting news for the country around this. So just as you mentioned there, in terms of, Hannah, what are the vaccines pregnant mothers need this winter?
Okay, so there's 3 vaccines that I'm going to talk about now. Okay. It's quite a lot of information. So I think the main message is for anyone who's listening who's pregnant, talk to your midwife and they'll be able to give you information about this. All the vaccines we're talking about today are free of charge, and you can get them usually somewhere that's quite convenient to you, like your local GP or pharmacy. But yeah, so ready for information overload. So the NHS is recommending this winter that pregnant women get vaccinated against 3 things. So flu, whooping cough, and the new vaccine against RSV, respiratory syncytial virus. So I'll just say a bit more about both of those. Yeah, so number 1, flu. So the flu jab is really to help protect mum and baby. And I think because we're all quite familiar with flu, we kind of forget that it can actually be quite a serious infection. But when you're pregnant, it changes how your body responds to infections, and you're actually more likely to get seriously ill from flu when you're pregnant. And also, if you were to get flu, it can also cause problems for your baby, like low birth weight, being born early, or even in the worst cases, being stillborn. So that's why we really recommend for people to get the flu vaccine to protect themselves against infection, but also to protect the baby. So flu vaccine you can have at any time in your pregnancy, and we recommend to get it as early in the season as possible. So it's available from 1st of September. So any time from then, go and get the vaccine, and you'll need it even if you had it last year.
Sure.
So then number 2 is whooping cough. So whooping cough is more about protecting the baby, because whooping cough can be really serious in young babies. But when you as the mum have the vaccine, your body builds up defences to the whooping cough bug, and you then pass them on to the baby, and that helps to keep them protected until they can have their own vaccinations when they're 8 weeks.
Sure.
So this vaccine is in your 2nd trimester, so you can have it from 16 weeks, but it would usually be around the time of your 20-week scan. And again, you would need this vaccine even if you've had it before or in a previous pregnancy. And then number 3, RSV. So this is the new vaccine. that we're so pleased to be able to be offering, because RSV is a virus, it's very common, and it causes infections of the lungs and the airways. And again, for young babies under 6 months, they're particularly at risk of getting serious lung infections like bronchiolitis or pneumonia. So again, if you as mum have that vaccination, you build up your defences, pass it on to baby. So for this one, it will be in your 3rd trimester, so around 28 weeks of pregnancy. And again, you'd need to be vaccinated in each new pregnancy. So, sorry, that was a lot of information. But in summary, 3 vaccinations: flu, whooping cough, RSV. And yeah, we just encourage people to speak to their midwife about each of those.
Fantastic. And there's more information on the NHS website as well.
Yeah.
Fantastic. So Dr. Nancy, if I can bring you in terms of why do pregnant women need to be vaccinated? What are the benefits of getting vaccinated in pregnancy?
Yeah, as my colleague Hannah just mentioned, for whooping cough and for RSV, for bronchiolitis, is really to protect the baby, because the mom can pass on that immunity and that protection to the baby from the day that they're born. So on day 1, your baby will be protected from the immunity you give to them from these vaccines. For flu is to protect both the mum and the baby. Like again, Hannah has mentioned, it avoids very serious infection for the mum and potentially going to the intensive care. That's the last thing you want when you're pregnant. And also it protects the baby as well from premature birth or even more devastatingly stillbirth. So we really want to encourage women to think about these 3 vaccines: flu, whooping cough, and the new one, RSV, for bronchiolitis.
Sure. So a lot of people listening to this, they might be thinking, is it safe to get vaccinated in pregnancy? So can you speak specifically about that, please?
Yeah, and that's such an important question. I know it's something that really plays on people's minds. And I think it's just really important to reassure anyone who's listening that vaccines go through a really strict testing process for safety and effectiveness. So all vaccines that are recommended by the NHS would have been tested in pregnant women, and the testing would have looked at any health issues for mum and baby. So any vaccine that is recommended has been through all of those tests and passed the tests. So I think people can hopefully feel quite reassured by that. And even once a vaccine is recommended, the NHS continues to monitor for safety issues using something called the yellow card scheme. So I think we just really want to reassure people that these vaccines have been really rigorously tested. But yeah, I know from my own pregnancies that it is something you think about really carefully, but I guess also weighing up these illnesses and how dangerous they can be. Actually, I definitely chose vaccination for myself.
Absolutely.
What did you think, Nancy, when you were pregnant?
Yeah, I remember as a first-time mum, and when I was expecting, I was thinking very seriously about what I was eating, what I'm exposed to, and medicine definitely took it very seriously. Even like paracetamol, I had to have a good look. Can I take it? And with vaccines, you really want to make sure and they are safe, and we are very confident to say these have been through very rigorous testing that they are safe. And for mothers, feel free to look for more information on the NHS website, and they have been tested, and you are conscious about what affects the baby, and surely and these will just give you that reassurance that it will protect you and your baby, and these give a lot more benefits to stop babies getting seriously infected and you or yourself going through that as well.
Fantastic. Listeners, you're here with us on Inspire 105.1 FM. This is the Health and Fitness Show, and we're specifically talking today about the importance of vaccinations. And there's been some recent news about RSV. So it might be people haven't heard of RSV or struggle to say the full name of it. Just break that down for us. What is RSV?
Yeah, sure. RSV, the full name respiratory syncytial virus, it commonly causes a disease called bronchiolitis. Some people might have heard of it. It's a really contagious bug. It's not a new bug. We're not we're now talking about it because there is a vaccine to prevent it. It's quite common. Thousands of very young babies get admitted to hospital every winter because of it. It causes a chest infection and it spreads really easily, especially in children. And often if someone in the household gets it, like an older child who pick it up from the nursery or the school, the whole family can get it. It's quite difficult to stop it spreading, and a vaccine can really protect pregnant women and their baby from getting this infection, and from very young babies to get admitted to hospital for it. In adults, it's quite a mild cough or a cold with some tiredness and fever, but in babies, it could be quite serious. It can cause this disease, we said, bronchiolitis, and it really affects very young babies' breathing, and that's where we see in the hospital admissions. And when babies go into hospital, they might need help with their breathing and feeding, and those are something we can avoid now with this new vaccine that is coming out.
Fantastic. So why is it important?
Yeah, so as Nancy said, RSV, respiratory syncytial virus, it is just a really common bug. So 9 out of 10 children will have had it by the time they're 2, and it causes those problems with breathing. And obviously then if you've got a small baby, if they can't breathe, then they struggle to feed as well. And unfortunately, it is responsible, this bug, for thousands of hospital admissions in young children every year, and 20 to 30 children every year do die from RSV. But obviously the good news is that it's now preventable with the vaccine. And I think we're just really hoping that people would take it up to protect their babies from the virus, but also to protect themselves from the stress of seeing your small child so ill. So I mentioned at the beginning with my older daughter, she's 4 now, but when she was a month old, she actually got RSV. And I think it was just, so she was born in the winter. In November, she was quite a small baby. She didn't feed that well at first. And so when she was about a month old, we kind of finally got her feeding back on track, starting to feel like, okay, we're doing well now. And then one day we noticed she had a bit of a temperature and she was obviously struggling to breathe. So she was kind of sucking her tummy in when she was breathing. Her nostrils were flaring, which are sort of signs that she was struggling to get enough oxygen and, to breathe properly. So called 111 and just to get advice, but literally within 5 minutes there was an ambulance at our house. We had paramedics in our front room. They whisked us off to hospital where they assessed her, and luckily after the assessment they sort of decided that she was safe to go home. But it was so frightening, as you're a new parent, you're just finding your feet, and then suddenly you're in the ambulance taking your baby to hospital. And so I think when Nancy and I were talking about this, it's kind of obviously the illness side, it can be really frightening, but also just the stress for you as a parent. It was Christmas time, we didn't see, after that we were too scared to see anyone over Christmas and New Year, all of those kind of knock-ons that you don't think about. So I think we just really hope that you can avoid that illness for your baby, but also that fear and stress for yourself. And that obviously that wasn't even a bad case, because we went to hospital but we were sent home. But I'm sure, Nancy, in your work in hospitals, you've probably seen some of the babies who are admitted with RSV.
Yeah, I remember when I was working on pediatrics ward, in winter you would see a lot of these cases, and in intensive care sometimes even 8 out of 10 cases would be from bronchiolitis and RSV. And I remember seeing the parents sitting around the bed with very young child, and the child has got breathing tube and feeding tube stuck down their nose and their throat. It's really uncomfortable for any young parent to see. And the worst thing, I guess, is as a parent you can't do a lot about it. You feel really helpless sitting around that bedside, and you just watch their little bodies to recover and hope that it doesn't progress any more seriously than that. So I think that if that's something that can be avoided by this vaccine, consider it. Talk to your midwife, talk to your GP about it, and really it could avoid a lot of stress. Going into the intensive care and seeing your baby being unwell is the last thing you want to see as a parent.
Yeah,
definitely. So as has been reported, nationally as well, this is really exciting news around the RSV vaccine being introduced. But Hannah, I guess again specifically specifically for the RSV vaccine is, the question about safety. Is it safe?
Yeah. And as we were saying, for all vaccines, any pregnant mum will be thinking, is this vaccine safe for me and my baby? And so as we were saying, like all vaccines, this new RSV vaccine has been through really rigorous testing for whether it's effective, whether it works, and whether it's safe. So this vaccine in particular has been tested in a study of almost 4,000 pregnant women, and they look at how does it affect the mum, how does it affect the baby, and no safety issues were identified in that study. And although this vaccine is new to us here in England, it's actually been being used in the United States for a while already. So over there, it's been given to over 100,000 pregnant women, and again, with a really good safety profile. So again, hopefully that people can just feel reassured this has been really rigorously tested and is also being used in other countries successfully before we're taking it up.
Great, that's really reassuring. So that sounds good. In terms of effectiveness, how effective is the RSV vaccine?
Yeah, it is very effective, and out of 10 babies who could get really ill from RSV, this vaccine can help 7 of them. And I can go a little bit more into the background of how vaccine helps us in our immune system.
Please.
As well. So in general, for any vaccine, it aims to boost your immune system. So if you imagine your immune system is a little bit like an army, it needs a lot of training to recognize any threats like bugs and viruses and bacteria. And vaccine does that kind of training. And when vaccine gets into your body, it shows your body a bit of the bug, and your immune system start to ring up alarm bells, recognize it, start to fight it off. So the next time when you get the actual bug, the army recognize it very quickly and fight it off really quickly. And you might not even know that you got the infection at all, because your body recognizes it so quickly and has fought it very, very effectively. When mum gets vaccinated, you pass on a bit of this army to your baby. The actual immunity is called antibodies with a technical term. And these get passed on to your baby through the placenta like any other nutrients. And this is how you can protect your baby from day one that they are born and really stop them from getting seriously ill from it.
Great. So listeners might be following this and thinking, it sounds really great, sounds really exciting, like we're all parents, and the last thing we want is for any of our children to be having to go into hospitals. So in terms of practically, Hannah, how is it, and when should a person get vaccinated?
Yeah, so as we were saying, there are 3 vaccines. So there's the new one, RSV, that we've been talking about, but there's also flu and whooping cough. And again, as I said, it's a bit complicated because the timing of each one is a bit different, and it will also depend on where you are in your pregnancy right now. Right. So again, at your next appointment, speak to your midwife, and they can help you to come up with a plan. But broadly, flu you can have at any time in your pregnancy, and the flu vaccine is available from the 1st of September, and we'd recommend get it as soon after the 1st of September as you can, because it's kind of early in the flu season before the bugs start circulating. For whooping cough, you can have this from 16 weeks of pregnancy, but it would usually be more around your 20-week scan that you have in the middle of pregnancy. But if you're already more than 20 weeks pregnant, don't worry, because you can have this vaccine right up until you give birth, and it's definitely still worth having, even if you're quite far on in your pregnancy. So again, speak to your midwife, speak to your GP. For RSV, the ideal time to have this is at around 28 weeks of pregnancy, so that's 3rd trimester. But again, if you're already further along than 28 weeks, don't worry. This vaccine will be available from 1st of September. You can have it right up until the point that you have your baby. So, yeah, flu, whooping cough, RSV, slightly different timings. But yeah, speak to your midwife to kind of come up with a plan of timings that works for you.
Great. Fantastic. It's really helpful to understand. So just moving on in terms of whooping cough, can you just explain a little bit more about that, Dr. Nancy, and the side effects?
Yeah, sure. Whooping cough, again, is very common currently because it's circulating in the UK. And really, unfortunately, we've seen 9 babies this year dying from it. And this is preventable with a vaccine. And I think we just want to keep emphasizing it's preventable and it can even cause death in very young babies. So please, lady, consider getting vaccinated to protect yourself and your baby. In terms of side effects for vaccines, all the ones we mentioned today, flu, whooping cough, and RSV, they're not live vaccines, so the side effects is usually mild if you get any. And there would be common things like headache, muscle ache, soreness, and some people might see some redness or swelling where they have the injection, but these are usually mild.
Fantastic. So, a question that might be pertinent, especially to Inspire FM listeners, is about the vaccine in terms of if it has any pork products in, and if it's considered halal for halal dietary requirements. Hannah, could you talk to us about that, please?
Yep. So just wanted to reassure people. So none of the vaccines that we're talking about today in terms of the flu injection that you would get as a pregnant woman, whooping cough or RSV, none of those have any pork products in at all. So there's no pork gelatin in them at all. And that's the case for most vaccines. But again, if you're worried about it, you can speak to your healthcare provider. But these 3 vaccines, so the injection of the flu vaccine, whooping cough, RSV, there's no pork gelatin or pork products in the ingredients at all.
Fantastic. That's great to hear. And then where can I get the vaccine?
Yeah, your midwife and GP would be the best place to start. From the 1st of September, we plan to roll out RSV vaccine in community clinics in Luton as well. And your midwife and GP could direct you to the place that's closest and most convenient to you. Sometimes it might be possible to have it lined up with one of your scans or appointment. And again, check with your midwife to come up with a plan and timing that suits you the best. If it doesn't line up with your usual hospital or GP visits, it might seem like quite a couple of trips, but these are really worth it because you don't want to get ill and go into the hospital with a young unwell baby. So it seems like a few trips, but it would be worth it just to avoid that hospitalization in winter and seeing your baby ill. So talk to your midwife, talk to your GP about where to get it and how to best line up with your schedule.
Fantastic. So listeners, you're here with us on Inspire 105.1 FM. This is the Health and Fitness Show, and we are specifically focusing today's show on the importance of vaccinations with a focus on the maternity vaccinations. Really exciting news in England. We now have a new RSV vaccination free on the NHS and available for all mums. And so I think it's really important that we understand that this is now available and actually how it can prevent babies and young children from having to be admitted to hospital as well. So I think as a public health community, it seems like a really exciting moment in public health around that we've been able to get this over the line. As the doctors have mentioned there, it's been operating in America for quite a while, so it's great that it's finally come here now, and that our community can benefit from this as well. So people might be listening and saying, this sounds interesting, but I would still like to get some more information. Where can we get more information from?
Yeah, absolutely. And obviously, for each person, you want to make that informed decision for yourself. So, obviously, we're really keen to encourage everybody to get vaccinated, to protect yourself and protect your baby, and to get those 3 vaccinations of flu, whooping cough, RSV. So, the best person to speak to is your midwife or your GP, and they'll be able to give you more advice, give you some information, address any concerns. Speak to a midwife or GP, or also on the NHS website, there's more information about these.
Fantastic. So unfortunately, we are approaching the end of today's show. So just as we've only got a couple of minutes left, just wanted to kind of touch on key messages, especially for anyone who's just joining us at the end of the show, Nancy.
Yeah, so 3 key messages. Number 1, anyone who is pregnant now should get 3 vaccines: flu, whooping cough, and the new vaccine RSV for bronchiolitis. Number 2 message is all the vaccines are safe to have in pregnancy, and they've demonstrated to be safe in testing and studies. And number 3, the new RSV vaccine for mother can protect their baby on day 1 for very, very common illnesses. And this one can save a lot of distress from going to a hospital or dealing with a really unwell baby. So please talk to your midwife and your GP how to get these, how to line this up with your schedule, and to protect yourself and your family this winter.
That's fantastic. And was there any other kind of key messages you guys were keen to share as well, just generally as we're approaching kind of winter time?
I think in winter there's a tendency to stay indoor, and all the respiratory viruses get circulated around. Yeah. So I would encourage people to go outside, get a bit of fresh air as much as possible, and that exercise is really good for you. I know when it turns dark and cold outside, it's really hard, but I would really strongly encourage it. And
and I was just thinking as well, the flu vaccinations for if you've got older children, so if your children are school age 2, 3, those are coming up too. So again, if you're pregnant and you've got older kids, make sure when you get that letter, give your consent, say yes, because again, it just helps, like you're saying, to protect your whole family. If you're all vaccinated, then you should all be safe.
Yeah, no, definitely. I think flu is the one is probably the most mentioned, so I think but therefore kind of we're a little bit complacent around it. So as you said, as parents we will all be receiving letters around children getting their flu vaccinations as well, so that's important that we protect all the children in our community as well. So it's great that we've got that offer in addition. So unfortunately we've completely run out of time for today's show, so I'd just like to take this opportunity to thank both our guests for coming over to Luton and joining us here today on Inspire 105.1 FM. We will every Thursday be producing a new version of the Health and Fitness Show. So if you've got any suggestions for topics you would like us to cover, please do get in touch with the studio. We'd be happy to bring some guests in to talk about that in more detail. So until the next show, Assalamu alaikum. Take good care.